Lifeline, the talk show that talks about mental health in Flagler County. Presented as a community service by AdventHealth Palm Coast Foundation. And now, your host, John Subers.
Good morning. I'm John Subers with AdventHealth Palm Coast Foundation, and welcome to Lifeline, a weekly show that addresses mental health right here in Flagler County. And we have part two of a show that's a continuation from last week that we have talked a lot about, IMPOWER. IMPOWER is a telemedicine organization that brings mental health to our phones and our adults and our physicians and our community and our kids. And this morning we have in the studio Wally De Aquino, our Chief Operating Officer. Hello, good morning, Wally.
Good morning, John.
We have John Fanelli, Coordinator of Students of Support and Behavioral Services with Flagler County Schools. Good morning, John.
Good morning.
And everybody in Flagler County recognizes Joe Rizzo, Education Foundation Director. Good morning, Joe.
Thank you for letting me be on, John. I appreciate it. Good morning.
Well, this is very exciting, guys, and certainly on the phone, the expert on IMPOWER is Amy Blakely, Vice President of Behavioral Health. Hello, Amy.
Good morning, gentlemen.
Just in a recap for our listening audience, last week, Amy and Wally explained the great advantage of IMPOWER in a telehealth, a mental health solution for our physicians and our community. And everybody, Amy, can log on to IMPOWER Florida or IMPOWERFLFlorida.org and begin getting mental health services. And there's financial grants available, so cost should not be a problem, but it was AdventHealth's solution for this void we have in Flagler County, and it goes much, much further. And let's just jump right into the schools. Guys, John and Joe, how do schools get involved?
Well, I think the first part is, like we talked about, Wally and I have been having this conversation for over a year now about making sure we're providing those goods and services that our 13,000 students need to be successful. So whether it's clothing, shoes, school supplies, and more importantly, mental health, what do we need to do to make it happen? And that's how the conversation started. And I think, bringing our team in, which the school has an extensive team that's led by John and his group, they've done an excellent job. And by bringing IMPOWER to the table, we have been able to make sure, one, identify those needs, and two, make sure that the services are available. So I think it's really exciting to find out where we're at and where we're going, because I think we're definitely paving the path to make sure that those needs are met.
John, how do the kids access it? And maybe Amy, jump in here and talk about IMPOWER and kids, and maybe a small overview for our new listening audience that didn't catch the overview last week.
So we have a saying in the schools and in mental health, and it's called no wrong door. So students can access mental health services just by telling somebody that they're in need, whether it's their teacher, a guidance counselor, anybody on the faculty and staff. If they let them know that they are in need of some additional support, the staff are trained in getting them to the right person to get them referred for services.
So, Amy, is that when your team gets involved?
Correct. That is exactly right. And we have individuals waiting to receive those referrals from the school system and reach out to the families to engage them in assisting the students in getting treatment that they need in the community.
So, John, one of the excitement about this project is that when we first engaged with IMPOWER in trying to bring a solution for our county, at that point when we learned that IMPOWER had extensive experience in dealing with kids and the ability to also serve with many of the kids who have Medicaid, which is extremely important, so they accept many payers, including Medicaid. We saw that this could be a potential solution for our community as well. And then in partnering with the school, they're very receptive. They have a great team that understands the need. It understands what our kids are going through in our community. I think this just brought it to another level. And we at AdventHealth are extremely happy to see this partnership growing between IMPOWER, the school, and us.
Amy, talk about child well-being. I know that one of the specialties over the years, the existence of IMPOWER, is your company has done extensive work in the child well-being foster care system. So you really specialize in kids' mental health. Is that not true?
Absolutely. That is absolutely true, and we're very proud of that. We have partnered with organizations all over the state to work with youth and their families with specific regard to psychiatric medications for ADHD or depression, bipolar disorder. We also work in mental health therapy, so individuals that need counseling are engaged through our telehealth program, and individuals who have substance use disorders and need substance use disorder treatment can also engage that way. And I'm so excited about the partnership with Flagler County Schools. I want to focus on something for just a moment that is so monumental in this new project, and that is the stigma. So let's just talk about that for a moment. One of the main reasons why people don't get treatment in mental health is because of the stigma. This holds true very much so in our youth. They don't want other peers to know that they're struggling or they're having problems at home. And so to provide them with an avenue through which to get these services in the privacy of their own home, from the privacy of their own smartphone or smart device, is really a huge development. And especially with our youth and the impact that the pandemic has had on families, we believe that is a huge step of progress that Flagler County Schools and AdventHealth has certainly recognized.
So, John, if I can just touch on that just for a second, the important part about that and the uniqueness of this is, one, I think COVID has given us some opportunities, but being positioned properly from a school standpoint, we are lucky enough in Flagler County that we have a half-penny sales tax that goes to our technology that's voted in by the voters. So that was the first big step, is making sure kids had devices. And we've been a one-to-one school district now for several years. So being able to make this happen and having those supports continue to go to those kids because of that half-penny sales tax that the voters support, we're allowed to make sure every one of those kids has that smart device, whether it's at home, whether it's in school, and it goes into their household. So they take them home with them. So it allows those parents to have those access to those smart devices as well. 64% of our kids are on free and reduced lunch. So we're also making sure that they have connectivity, whether it's through hotspots or through internet services. So really and truly, we are making sure that that link is available, which is amazing.
That is amazing, and the things that Flagler County Schools is doing for our kids, and that's a whole nother show of all of those activities. But John Fanelli, when a child is identified through whatever your means are that are struggling, suicidal tendencies, bullying, whatever the domestic violence, whatever it is, are those kids allowed to have a therapy session at school in their privacy, or link in with the parents and go at home, or I'm sure there's no normal, but what's a usual?
Well, we provide services in a variety of ways, sometimes on campus, face-to-face, sometimes through technology or device on campus or remotely. We really look at what the needs are of the student and the families, and we try and customize a response that would be at the highest level possible to support that student and their families. That's why it was so exciting to get into this partnership with IMPOWER, because they bring some things to the table for Flagler schools that we weren't able to support students with what we had available. They are able to provide underinsured and uninsured families with services free of charge, and that is huge. A lot of times it's not just the uninsured families, but the deductibles can be so high that even though they have insurance, they're just not able to access appropriate health and supports for their family. So this partnership is amazing, and it is helping to break down some of those barriers, whether it's transportation. A lot of our families just can't even get to the doctor. So to be able to bring the doctor into the home to them, to be able to provide those services in the comfort and supportive environment of their own home is absolutely amazing.
So, Wally, the overall health of our community is certainly at the forefront of why AdventHealth is in this community for the overall health and being a partner. And there's so many things AdventHealth and Flagler County Schools does together for the family unit, and bringing IMPOWER and being the connectivity to a healthier family. We all know, we've said on this show many times that, and you mentioned, Amy, the stigma that mental health can be, I take a pill for diabetes and my heart, my blood pressure. So it's okay to be on medication for mental health if it makes me feel healthier and being in a better place. And that we're trying all to get rid of that stigma. But from AdventHealth side in our community, why is this just a great relationship? And why are we so engaged in the school and the thousands of families that are in this community?
So if you look at the many of the marketing initiatives from AdventHealth, we try to send a message that it is extremely important for us to look at ourselves and others as a whole. Yep. And we want everybody to feel whole, right? And the mental health is such an important component of this, because if you have a healthy mental health, it will allow you to make all the right decisions to take care of yourself and others. Now, when we look at our kids, this is the future of Flagler County. This is the future of our state and our country, right? We need to make sure that we're taking care of them right from the start. These are kids that are going to school, that are learning, and we have such a great school department here, and we're able to partner with them to make this beautiful impact. I'm just extremely excited because we're finally seeing the result of some hard work between the school and others and ourselves here at AdventHealth Palm Coast that are going to make a difference. And now we have another partner in our community that's going to be a part of this great work. Amy, I wanted to ask you a question. So I'm sure that there are many parents listening to our show right now, and they're asking, so let me understand the process a little bit. So the school identifies a kid that may need some help. I'm going to assume, John, that the school connects with the parents as well.
Yes, so the referral will come in, and then Brandy Williams, our counseling coordinator, will look at what the needs are on the referral and then refer it out to the appropriate agency, such as IMPOWER. And then once we refer it out to IMPOWER, then they kind of take it from there. So
then Amy, that's when they connect with the parents?
Correct. So we will treat minors only with parental or legal guardian consent. And so our practitioners or support staff will reach out to those folks of the students in Flagler County, and we'll engage them and advise them what the treatment will look like, how to get an account and get the app on their phone, and we will walk them through the process of what it's like to have telemedicine behavioral health services. And oftentimes what we're finding when we do that is we're engaging the families. Yeah. We're engaging parents who aren't at the school, who would otherwise not get treatment. And parents are saying, hey, I could benefit from this myself, and so can my other 3 kids.
Right.
And so oftentimes, as you mentioned, it's the family unit that ends up getting treatment, not just the student. And as we all know, many times some of the challenges that our students face stem from unhealthy homes. And if we can take it a step further and get into these homes and engage other family members in treatment as well, then we can really make some good progress in the community.
And by being online, it's extremely easy for us to see IMPOWER reaching out to different homes, right? And the other benefit also, Amy, is that I'm assuming, I know that you're able to schedule after hours, so the parents don't have to worry about leaving work early because they need to bring their kid to a clinic. They're Correct. Able to come from work and schedule at a time that it works for them.
That's absolutely true. As a matter of fact, the majority of our services occur between 4 p.m. and 8 p.m. On weeknights. And then we also provide services on Saturdays for individuals who can't make the weekdays work. And just in terms of continuity as well, I'd like to just point out another benefit of the telehealth program with Flagler County Schools and AdventHealth, and that is that we're able to continue treatment through holidays, spring break, Christmas break, summer breaks. And so there's no interruption or disruption in their continuity of care. The treatment can continue across the school years. And also, if individuals move to different schools within Flagler County, they're still able to continue on with their same practitioners. So it's really conducive to a great continuity of treatment as well.
We've kind of touched on this, but I'm going to ask this to Amy, you, and to John Fanelli. If our listening audience, and there's a mother or a father at home listening to us today and says something, my son, my daughter, something's just not quite right. They're not as happy, whatever the case may be going, I guess they can call IMPOWER directly or go online. But John, what is the path if a parent sees something at home and would like the school to get involved to help guide that student? Sometimes I've had 3 sons and they didn't want to listen to me. Somebody else could talk to them better than I could. So if a parent is at home, John, from the school system, what can you tell them to do? What kind of steps?
All they need to do is reach out to their child's school, whether it's to the teacher, the guidance counselor. Let them know that maybe there's a loss of a significant loved one, or there's some trouble or trauma going on in the home. And if they make us aware of that, it's a simple and easy process for our guidance counselors to complete the referral, get it over to our office. We have, again, I know this was mentioned in the show last week that there were a few good things to come out of COVID, and it's our advancement in technologies. We can email you all of the consents that you need. We have processes to get you those consents. You don't even have to come and see us. We can have them to you and back to us instantly. And when you reach out to the school, we can have you referred out that day.
What a great service that is, to be able to immediately get somebody online to get a therapy session, at least a plan for that family to become healthier.
Yes. Well, we know when there's a mental health crisis, it's an immediate crisis, and it's something that needs to be addressed in a timely manner. So we've worked to really expedite all of our processes to make sure that we can link our students and our families to support as quickly as possible.
And Amy, I'm guessing your team over the years and all of your experience, when you have an immediate action that needs to be attended to right now, if it's a suicidal type of threat, which nobody likes, but it's real. And I think in Flagler County, our numbers are coming down, but it's still very real and something we got to pay attention to, as well as our seniors in our community. But you have systems set up for immediate action?
Absolutely. Yes, we can help, and we have very short wait times for individuals to get into treatment. And so with our telehealth model, we're able to get individuals the help that they need really quickly. And a big part of this also is because we're increasing the access to treatment for everybody, in general, we can avoid crises because we can intervene earlier. And the name of the game is to try to prevent that from occurring and to allow this opportunity for individuals to get this treatment in their own homes and for free. We're trying to engage people earlier in the game when they feel that they need some assistance, as opposed to waiting until a crisis situation occurs.
I have a question for the group, because we're all in kind of different categories, but we talked about COVID, and the one thing that good came out of COVID, we talked about that, we'll all agree, but certainly, Amy, you've been at this a while, pre-COVID, during COVID, and if we're coming out of COVID now. But did COVID provide a greater volume for IMPOWER?
Absolutely. It has. And as I've told you before, we started using telehealth about 9 years ago at IMPOWER, and we are the state's leading provider in telemedicine for behavioral health. We have conducted over 1 million telehealth visits now. But certainly the last year has extremely accelerated the use of telehealth and telemedicine, and we're front and center. We're ready to go. We have been for quite some time. So it is sort of a silver lining in the pandemic, and we're happy to be well positioned in working with AdventHealth and Flagler County to make that happen in your community.
John Fanelli and Joe Rizzo, from our kids, just normal activity, granted, strange year in school, not in school and all that, but have you all seen a tick up in mental health needs? And we have a solution here, which is fabulous, but is there a greater need than there was a year and a half ago?
Well, the needs I think John can touch on. I know the crazy part is that because of this community partnership, the connectivity, the ability to solve them is probably the one thing that I've seen come out of COVID. John can probably tell you more about the need.
I'll tell you, this year for sure, we've seen an uptick in the amount of referrals that we're receiving. We've currently had more referrals this year, more referrals currently today this year than we've seen in last year or the year before. So we've exceeded both of our prior year numbers regarding mental health referrals, and they're still coming in strong. On an average day, we're seeing probably anywhere from 5 to 7 referrals.
Oh, wow. And Wally, from the AdventHealth side, we really spoke about it last week, but it's our physicians, community physicians, primary care, having an outlet for an IMPOWER to refer patients to for their mental health needs. I'm guessing we've seen a spike in our needs for this solution-based activity we're doing.
Oh, absolutely. We hear more and more, and now we're happy that we have a solution here for our community, and not only for our community, for our kids as well. The school department has worked hard to make sure that they can provide a service, a solution, and now they have another tool, another partner to be able to address this. And we're very thankful for the school department and Joe Rizzo and everybody and John who worked in making this happen.
Well, guys and girls, we're coming to the end of our segment, and just in closing comments, and Amy, I'd like you to tell our listening audience one more time of how they can begin the journey with IMPOWER. Please provide your website and how to do that.
Yes, please visit our website at www.impowerfl.org, and that's IMPOWERFL.org, and sign up for services. You'll see on our homepage 2 big buttons to click on to refer yourself or your child or another person. And we have staff waiting to receive those inquiries and help move individuals and their families through the system quickly.
Wonderful. Joe and John, closing comments and the great services that Flagler County Schools providing not only our kids, but their entire families in so many different areas.
Well, just real quick, I've been doing this direct support of the school system for the last 4 years, and the leadership at the schools right now with Superintendent Middlestat at the helm is really exciting that she made it important to push this forward, and to have the community partners like AdventHealth and IMPOWER to come to the table to really and truly solve a problem and move forward has been the most rewarding part to watch.
And I think it is a problem, and we are solving it. So well said. John?
I would agree with everything that Joe said from the leadership of the schools, AdventHealth, IMPOWER, all working together to provide the highest level of care and support to our students. Thank you to everybody, and I'm glad that we're seeing the mental health conversation move forward.
Well, thank you. Wally De Aquino, closing comments.
May is Mental Health Month awareness.
Yes, May is Mental Health. Perfect timing.
Exactly. And we're going to remember this May from 2021 that we started something here together to make a difference in our community.
With that, this is John Subers with Lifeline. Hope you listen next week. Thank you very much.